Steve Ryan, how are you? I had it. Mine was what?
It sure sounds, from talking with you, it sounds like you had atrial fibrillation, because when you have atrial fibrillation, it feels like your heart's going to jump out of your chest.
And scares you. I lose control. You think you're losing control. Am I right?
Absolutely.
You lose, it's sinking sensation.
Well, here's what happens with atrial fibrillation. The upper part of your heart is supposed to pump down.
Right.
Instead of that happening with atrial fibrillation, instead of that pumping down, the upper part of your heart starts going like this.
Right.
Going like this. It fibrillates, it quivers, it vibrates.
That's right.
And blood does not get down to the lower part. So you're losing a lot of volume of blood that isn't going to the rest of your body, into your brain. What happens is that when you first develop it, over time it gets worse. You develop fibrosis, your attacks become more often, they become longer, your heart remodels. It actually remodels. Your heart actually changes in shape because the upper part of your heart extends and dilates because it isn't pumping properly.
How do you treat this thing?
The normal way that people treat it, which I don't necessarily agree with, is medications. But unfortunately, we don't have any good medications right now. They either don't work, they lose their effectiveness, or they cause bad side effects. We don't have a magic pill that will cure A-Fib right now. You need to, because your heart isn't pumping properly, it's real easy to get a clot because the blood stagnates up there.
Oh,
okay. And when a clot forms, let's say it'll form like usually in what they call the left atrial appendage, because that's the area where blood doesn't move it very well. When it breaks loose, then all of a sudden it goes to your brain and your legs or whatever, and all of a sudden you got a major clot and you're half paralyzed or you're dead. So you need to be treated if you have atrial fibrillation. You need to be on blood thinners. All things considered, if you're real young and you're real active, you may not need to be on blood thinners, but that's something you need to discuss with your doctor, whether or not you need to be on blood thinners if you have atrial fibrillation.
You had it yourself?
Yes, I had it 15 years ago, yeah.
And you cured yourself?
Yes, well, I didn't cure myself. The doctors cured me with a procedure called catheter ablation.
What's that?
Okay, very simple. They run a catheter through a vein in your groin, run it up into your heart, and burn off these spots or isolate these spots that are producing these extra pulses.
Right.
It's a very simple operation. It's low risk. There's no surgery involved. There's no cutting. And what I want to stress to anyone listening to the show is that A-Fib can be cured. You don't have to live with A-Fib. You don't have to live on meds for the rest of your life.